Hello, my name is Cassidy and I'm going to be your student nurse today. Is it okay if I perform a musculoskeletal assessment on you? Okay, perfect. So first, I'm going to perform hand hygiene. And I'm going to ask you to stand up and I want you to walk towards me. So, wait for a second. So as my patient is going to walk towards me, I'm assessing their gait. I'm looking for any abnormalities in their gait, such as limping or difficulty ambulating. Okay, perfect. You can go ahead and sit down for me. So as my patient walked towards me, I noticed her gait was completely normal. There was no difficulties there. Next, I'm going to inspect the hands. So do you have any problems with your hands? Do you have arthritis? Okay. So as I'm looking at her hands, not only am I looking at the muscles, but I'm looking at the bones and joints of the hands. So I'm going to palpate her hands. Does this cause you any pain or discomfort? Okay. I don't notice any redness, swelling, inflammation, or neither is it warm to the touch. Okay. Next, I'm going to assess the range of motion of the hands. So I want you to put your hands like this and go up and down, checking flexion and extension, the fingers out and in, abduction and adduction, and then I want you to move just your fingers up and down. Okay. Range of motion was normal, and she showed no limitations in her hands or her fingers or wrists. Next, I'm going to test the strength. So go ahead and go up again. I'm going to apply slight resistance, move your fingers outward, back in. Okay, and then I'm going to do the grip test. So I want you to hold on to my fingers, and I'm going to try to pull out, and I don't want you to let me. Okay. Patient's grip was equal and strong bilaterally, as well as everything else. So I rate her strength a 5 out of 5. Next, I'm going to assess the elbows. So do you have any problems with your elbows? I'm looking at the elbows for any redness, swelling, or inflammation, which I don't see. I'm going to palpate the elbows. Cause any pain? Any pain? Okay. Everything appears to be normal and equal bilaterally on both sides upon inspection and palpation. Next, I'm going to assess the range of motion. So I want you to hold your arms up like this, and this is going to be extension and flexion. Patient has full range of motion in her elbows. Next, I'm going to assess the strength. So go ahead and hold your arms out like this, and I want you to resist me. Okay. Okay. Patient was able to overcome my resistance. I grade her elbow strength a 5 out of 5. And as we were testing the strength, that's really testing the strength of the biceps and the triceps, which was completely normal. Next, I'm going to move on to the shoulders. Do you have any problems with your shoulders? Have you broken anything? What about your collarbone? I'm just going to take a look at your shoulders. I'm looking for redness, swelling, or inflammation, which I don't see. I'm going to palpate from the shoulders inward to the collarbone. Does this cause you any pain or discomfort? If the patient had broken a collarbone and it healed, it would maybe feel a little bit more dense, which I don't see. Patient indicated no breaks anyway. So everything's normal, and she reports no pain. So everything is equal bilaterally. Next, I'm going to test the range of motion. So what I want you to do is go all the way up, go back, okay, and then one shoulder at a time, go all the way out, up, across, other side. Okay, then I'm going to check internal and external rotation. So hands like this, behind your back, palms outward. Okay. And then I'm going to check circumduction, so go ahead and do a full circle for me. Did any of that cause any pain? No pain indicated, and full range of motion was intact, no limitations there. Next, I'm going to test the strength of the shoulders, so hold your arms all the way out. And I want you to push down against my hands. Okay, turn over, push up against my hands. And patient was able to overcome resistance, so I rate her strength of her shoulders a 5 out of 5. Next, I'm going to test the cervical spine of the neck. Have you ever had any breaks to this area? Okay, so scoot forward a little bit for me so the camera can see. Okay, and as usual, I'm looking for redness, swelling, inflammation, or anything of that sort, which I don't see. I'm going to palpate using 2 fingers on either side. Does this cause any pain?
No.
Okay, patient reports no pain and I don't feel anything unusual. Next, I'm going to check the range of motion of the neck. So I want you to go up and down, side to side, ear to ear. Okay. Range of motion is completely normal and no limitations. Next, I'm going to test the strength. So I want you to push against my hand, the other side. Okay. Strength is normal, 5 out of 5 again. Next, I'm going to move on to thoracic, lumbar, and sacral spine. So I'm going to ask you to stand up for me. Okay. Have you ever had any breaks or problems with your back or lumbar spine? Okay. So I'm going to palpate the spine again with 2 fingers. Let me know if you feel any pain or discomfort. No pain? Okay. Again, that's just standing up. I'm looking at the shoulders and the hips. I'm looking for any deviations if one shoulder or hip was higher than the other. That could indicate scoliosis, which I don't see. Curvature of the spine is normal, and I don't know anything abnormal there. Next, I'm going to ask my patient to bend down for me like they're touching their toes. I'm really just exposing the spine so I can better palpate. Any pain? Okay, perfect. Next, I'm going to ask my patient to bend back for me. I'm checking the range of motion. Okay, go to the side a little bit. I'm going to go side to side. Yep. Okay, perfect. No limits in range of motion there. Okay, you can sit back down for me. I didn't see any abnormalities at all in that area of assessment. Next, I'm going to assess the hips. So first, I'm just going to palpate the hips. Well, have you had any problems with your hips? Any injuries? Any falls? Does this cause any pain or discomfort?
No.
Okay. Again, looking for redness or swelling. I'm not going to take her pants off, but and also as she was standing up, I didn't see any deviations in one side of the hip as opposed to the other. Okay, so go ahead and lay down for me with your head facing the with the head facing the headboard. Okay, so we're just going to test the range of motion of the hips. So I want you to raise your right foot up and down. Okay, and your left foot. Okay, go ahead, take your left foot, bring it out and all the way across as much as you can. Good. The other one. Okay. And then can you roll over for me? Go ahead and bring your leg up to the ceiling. Other side. Okay, roll back over one more time. Okay, range of motion was normal, no limitations there.
Sorry, Sophie.
And she indicated no pain upon movement. Next, I'm going to test the strength of her hips. So I want you to push up. You do it bilaterally at the same time. Okay. And go ahead and push down against my hands. Other side. Do both at the same time. Okay. Strength was normal. She was able to push down against my hands and push up. Strength of the hips is 5 out of 5. Next, I'm going to, so typically I would do the knees, but since she's already laying down and you can see, I'm just going to move on to her feet and go back to her knees. That way she doesn't keep having to move. So can I take your socks off?
Sure.
So I'm inspecting the feet and the ankles. I'm looking at the ankles for any swelling, redness, inflammation. Have you ever had any breaks to your feet or your ankles, sprains?
No. Yes. Sometimes.
Okay. Yes, she actually has. She has foot problems. So, feet are slightly colder than the rest of her body, which is a normal finding. I want you to let me know if you have any pain upon palpation. Palpating the feet. Does this hurt your toes?
No.
Okay. Alright, I don't know anything unusual upon palpation. No redness, swelling, inflammation, or anything of that sort. Okay, so I'm going to test the range of motion in her ankles. So I want you to move both your feet up and down. And in and out. perfect. That cause any pain?
No.
Okay. And then I want you to move just your toes up and down. Okay. So I do no abnormality there. She's able to move these toes up and down, but not these ones, because she actually has had multiple surgeries and she's not able to move her toes downward, but that's expected with her because I know her medical history. Sorry. But everything else is normal there. And now I'm going to test the strength. So I want you to push down against my hands and push up. Okay. Everything else was normal and equal bilaterally, and no unusual or abnormal findings there. Lastly, I'm going to assess the knees. So,
It's on my toe.
sorry. Did that hurt?
Yeah.
Sorry.
It's okay.
Okay, so go ahead and sit up for me. Okay. Do you have any problems with your knees?
No.
Okay. So, I'm obviously inspecting the knees, and I would look for any redness, swelling, or inflammation, which I don't see. I'm going to palpate the knees. I'm feeling for any edema, inflammation, tenderness. Does this cause any pain? Okay, which patient reports none. Next, I'm going to assess her range of motion, so I want you to move your legs out. Other side. Okay, perfect. Okay, next I'm going to test the strength of the knees, so I want you to push out against my hands and push in. Okay. Everything was normal and equal bilaterally. No abnormal findings upon inspection, palpation. Range of motion was normal and no limitations, and strength was normal and great. I graded a 5 out of 5. So that is the end of my musculoskeletal assessment. Patient's normal. I didn't see anything abnormal, so good job.